We're going to be doing a seated figure 4 stretch. Cross your right foot over your left thigh. Bring the green loop band around your metatarsals, your toes. Thread the arm closest to that band through it towards me. Keep the arm straight with a micro bend in the elbow to work your scapular stabilizers. From here, ankle mobility to combat pronation in the feet. Moving the foot, look at my hand, away from the body and back to parallel. Away from the body and back to parallel. Subtle isolation while we're in this hip stretch seated. Try to sit up tall. Try to use your back muscles. This is also a strength exercise for the lats that attach under the armpit so that we don't get kyphosis as the weight increases. And then when you begin breastfeeding, we don't want those rounded front shoulders. We want a nice upper back, tall, proud spine. So this will help with that. Couple more here, eversion. And let's do one more. Take the band off and fold over, smelling that foot as well as you can with your baby bump. Breathe here. Inhale 1, releasing that outer hip. Exhale 1, relaxing the mind. Inhale 2, lifting up way below the belly button on the muscles that stop your stream of pee. Exhale 2. Inhale 3. Exhale, rounding up, switching the cross of the legs, bringing that loop band around the metatarsals. Thread the other hand through. Arm is in scaption. The other arm can be in scaption too or by your side. Palm facing in towards the body, elbows soft. Begin the eversion footwork, moving the foot away from the body and back to parallel. Building strength in the lateral intrinsic muscles of the feet to combat pronation. We always work from the ground up because that's where change really can happen. Because what is happening in the feet and ankles affects the whole chain of the body. Stay lifted. Use this as a chance to strengthen your back at the same time. If the arm gets tired, you can always lower it a little. Breathe. Only 10 more seconds here, and then we'll take that fold. Hang on. 5, 4, 3, 2, 1. Take that band off. Set it to the side. Smell the foot folding forward. Hold it here. Inhale 1. Breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Rounding up. Take a moment to go set that chair to the side as well as the green loop band. And we'll set up for a step to balance in the frontal plane. We'll need our 3-pound weight and our orange loop band. The orange loop band is going to go around our ankles. We'll be doing a hamstring curl and an overhead press. So watch me one time. I'm going to turn my back to you. Part of the exercise is stepping to balance. The hand that's not holding the weight can do the same thing the hand that's holding the weight is doing, or it can be on the hip or by the side of the body. So I step to the side onto a parallel leg with a soft bend in the knee. I'm wearing that backpack of cement. I bring the arch of the inside foot into the band, pointing the toes, holding in a hamstring curl. So be my advice to extend the leg and then do the hamstring curl, and we'll hold for 3 breaths. Okay, join me. Arm is in shoulder flexion. Take it up. So we're going to step to the side to balance, bring the arch of the foot into the band, kick into the band, hamstring curl, isometric hold here. Inhale 1, breathe. Exhale 1, backpack of cement on. Inhale 2. Exhale 2, gaze up higher than eye level. Inhale 3. Exhale, pass the weight. Switching sides, stepping to the other side, finding the balance first, bringing the arch of the foot into the band, extending that leg back, pointing the toes, kicking the heel to the butt. Hold. Inhale 1, breathe. Soften your supporting knee. Exhale 1. Inhale 2, square your pelvis to the wall in front of you. Exhale 2. Inhale 3, soften your chest in towards the back body, putting on your backpack of cement. Pass the weight, second time to the first side. Step, find the balance, bring the arch of the foot into the band, extend the leg back fully, and then bend at the knee joint, kicking the heel to the butt. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3, switch the hand, final set, step to balance, arch the foot into the band, extend the leg back, toes pointed, hold it here. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Beautiful. Let's set that orange loop band and 3-pound weight to the side, coming over to the wall for some well-deserved stretches. Start with your dominant arm in a high V, twisting the torso away from it. Step the leg closest to the wall back, just a foot, bend the knees, tuck the booty under, drive the pelvis forward. Solely a stretch, while we also open the anterior delts, the front of our shoulders. 6 breaths here. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Readjust the arm only, keeping a bend in the elbow, taking the arm to a T, still twisting away. Bend the knees, tuck the pelvis, drive the hips forward. Rotation from the rib cage. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Slowly turn to face the wall. Bring the other arm into a high V, micro bend in the elbow. Inside leg steps back only a foot. Bend the knees, tuck the booty under like a scared puppy, drive the pelvis forward, twisting the torso from the rib cage away from the arm with a micro bend in the elbow. You're on the inner edge of the thumb and wrist, so the arm is internally rotating a bit with the shoulders plugged down. Pelvic flexion, driving that pelvis forward. Beautiful. Slowly change the arm to your T position with the elbow soft. Pec major stretch here. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Beautiful. Option to sit in your chair for this next flexibility exercise or to stay standing. We're going to grab our trigger ball and we're going to roll out the fascia of our feet. The feet get exhausted from the added weight and need attention. So go get a foot massage. Make sure you're wearing shoes that are good for your posture. So for KLP and LP, pronation, you want to combat that with your shoes. For sway back posture, supination, you want to combat that. And flat back, flat-footed footwear. So just be mindful of that when you're buying shoes. Very important to take care of your feet. Start with your dominant foot, rolling out that fascia. We'll be doing this for a minute, so if you're tired of standing, feel free to take that chair, sit in it, and apply as much pressure as you can tolerate, rolling all around the arch of the foot, the metatarsals, the heel, noticing where in your feet you're tight. Is it the arch? Is it the outer edge, the inner edge, the heel, the front, the metatarsals? Give it attention, circular motions, digging down, moving the ball around, and breathing. Try to not throw your torso forward here. See if you can sit upright and use your low abs and your shoulder blade anchor, pulling the shoulder blades together, softening the sternum in, wearing that backpack of cement. We're still on the first side. I'm giving you a full minute on each side for this foot care. This should feel fabulous. Utilize this time. This is your time. Switch feet, switch your foot, and begin rolling the other foot out. You're in charge of how much pressure you put. If you really want to be aggressive, you can be aggressive. If you want to be as gentle as you'd like. But make a conscious effort to not slouch while you're doing this. When we work out together, I want you to be focused on your core and back integration in everything you do. And hopefully that will translate into you thinking about it as you move through space and move through your daily activities. We want to build those good habits. 20 more seconds to really get into that tissue. Take your time. Breathe. Work those knots out. Is your gaze down? Can you bring it up higher than eye level? Can you soften the front ribs back towards the back ribs, putting on that backpack of cement? Beautiful. Set the ball to the side now, and if you grabbed the chair, go ahead and set that chair to the side, making your way back to center and picking up your red Theraband. Let's all roll our shoulders back for 10, 9, 8, knees soft, 7, 6, 5, 4, breathing, 3, 2, 1. Great job. We'll need our red Theraband for our sumo squats. We're going to stand on the end of it. Now, if you've never done sumo squats, we're simply externally rotating subtly from the top of the hips, and we're letting our inner thighs pull us back. I don't want to see pitching forward with your upper body. You put that backpack of cement on. Both arms that are loaded will go to shoulder flexion at the bottom. And we'll be doing some head turns on our exhales and then sitting deeper on our inhales, head turns again, 3 breaths at the bottom. So join me for this set. We'll learn as we go. Inhale, prepare. Exhale, inner thighs pull you back, shoulder flexion, shoulders plug down, wear that backpack of cement, no forward lean. Inhale, pelvis grounds down. Exhale, turn your head. 2, 3, 4. Inhale, pelvis grounds down. Exhale, turn the head as the inner thighs are pulling you back. Inhale, pelvis grounds down. Exhale, turn the head. 2, 3, 4. Inhale, stand up without locking your knees. That's all we're doing. Let's repeat. Inhale, prepare. Exhale, inner thighs pull us back. Inhale, grounding the pelvis towards the floor. Exhale, turn the head. 2, 3, 4. Inhale, pelvis grounds down. Exhale, inner thighs pull back. 2, 3, 4. Inhale, pelvis grounds down. Exhale, inner thighs pull back. 2, 3, 4. Inhale, lifting up. Don't lock the knees. Final set. Exhale, inner thighs pull back. Inhale, prepare. Exhale, turn the head. 2, 3, 4. Inhale, pause. 2, 3, 4. Exhale, turn the head. 2, 3, 4. Inhale, pelvis pulls down. Exhale, inner thighs pull back. Turn the head. 2, 3, 4. Inhale, standing up. Don't lock the knees. Switch the band to the other, under the other foot. Loading the other arm, setting up. Wrapping around the knuckles with the thumb on the outside. Make sure there's just subtle rotation from the top of the hips. You're not over rotating. Inhale, prepare. Give you a few more seconds. Sometimes it's hard to get that band situated under the foot. Brace those abs. Go ahead and let your inner thighs pull you back. Find shoulder flexion. And beautiful. Turn the head. 2, 3, 4. Inhale, sit lower. Exhale, turn the head. 2, 3, 4. Inhale, sit low. Exhale, turn the head. 2, 3, 4. Inhale, standing up. Inhale, prepare. Exhale, inner thighs pull you back. Inhale, ground down. Exhale, turn the head. 2, 3, 4. Inhale, pelvis grounds down. Exhale, inner thighs go back as you turn. 2, 3, 4. Inhale, pelvis grounds down. Exhale, turn the head. 2, 3, 4. Inhale, standing up. And let's do one more set. Inhale, prepare. Exhale, inner thighs pull us back. Inhale. Exhale, turn the head. 2, 3, 4. Inhale, pause. 2, 3, 4. Exhale, turn the head. 2, 3, 4. Inhale, pause. 2, 3, 4. One more exhale. Turn the head. 2, 3, 4. Inhale, standing tall, not locking out in the knees. Slowly go ahead and set that band to the side. We're going to need our green loop band, bringing it around our ankles. We'll hold our foam roller overhead facing one another. Watch me one time. I'm going to extend my right toes, pretending they're at 12 o'clock. I'm going to take a quarter turn onto my right foot, finding my balance, bringing the arch of my left foot into the band and extending the leg out, externally rotating it. Once I have my balance, I'll inhale, exhale, small pulses of the leg. 2, 3, 4. Inhale, pause, leg is straight, toes are pointed, soft bend in the supporting knee, back is upright, and I pulse the leg. 2. I repeat this 3 times. Join me. Let's face each other. Extend your right leg to 12 o'clock, quarter turn to 3 o'clock. Find the balance first. Bring the arch of the foot into the band, extend the leg back, externally rotate it. Hold it here. Inhale, exhale, pulses up. 2, 3, 4. Inhale, pause, and these are small little pulses. Exhale, pulse. 2, 3, 4. Inhale, pause. Exhale, pulse. 2, 3, 4. Inhale, come back to center. We'll switch sides. Extend your left leg. Quarter turn from 12 to 9. Find the balance. Arch of the right foot into the band. Kick back. Externally rotate the leg from the hip socket. Toes are pointed. Inhale, prepare. Exhale, we pulse. 2, 3, 4. Inhale, pause. Exhale, pulse. 2, 3, 4. Standing upright. Inhale, pause. Exhale, pulse. 2, 3, 4. Inhale, come back to center, extend that right leg, brace the abs, quarter turn, find the balance first. Left arch of the foot into the band, external rotation, pointed toes, deep lift of the core, backpack of cement on inhale. Exhale, pulse, 2, 3, 4. Inhale, pause, 2, 3, 4. Exhale, pulse, 2, 3, 4. Inhale, pause, 2, 3, 4. Exhale, pulse, 2, 3, 4. Slowly turn around. Final set. Extend your left leg. 12 o'clock. Take it to 9. Bring the arch of the foot into the band. Extend that leg back. Externally rotate the leg. Hold it here. Inhale 1. Breathe. Exhale 1. Inhale 2. Still adding those pulses. Exhale 2. Inhale 3. Exhale 3. Beautiful. From here, we can now take off that band, set our foam roller to the side, make our way over to our wall for a stretch, bringing our arm into a cactus position, pec minor stretch, and twisting away from that arm, stepping the inside leg slowly back into a lunge to stretch out the calf. Hold it here, 6 breaths. Inhale 1, breathe. Exhale 1, driving the pelvis forward, getting into the calf and the back leg's hip flexor, twisting from our torso away from the arm on the wall to open up our pec minor. 3 more breaths. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Slowly step that back foot in and make sure you turn towards the wall. Bring that arm off the wall. Bring the other arm up into that cactus position, elbow in the same plane as the shoulder. Create that right angle. Slowly begin to twist away. Step the inside leg back into a lunge. Lift up way below the belly button on those muscles that stop your stream of pee. Collarbone wide, chin lifted, gaze soft. Breathe with me here. Inhale. And exhale. Good. Inhale. And exhale. You can bring that outside hand to your baby bump. And hold that, and as you inhale, breathe laterally. As you exhale, pull the belly in towards the baby and lift up on the muscles that stop your stream of pee. Sustain that lift. Exhale. Inhale. And exhale. 2 more breaths here. Inhale, 2, 3, 4, and exhale, 2, 3, 4. 1 more. Inhale, 2, 3, 4, and exhale, 2, 3, 4. We'll slowly face the wall to come out of this stretch. And let's make our way onto all fours for some back releasing and neck releasing. Knees on the floor, wrist under shoulders, round the spine, gaze through the legs. Inhale. Brace the belly. Exhale, arching the upper back only. Inhale, rounding both the pelvis and upper back. Keep the pelvis in flexion and arch the upper back only on your exhale. Again, inhale, rounding, tucking the pelvis under even further, trying to sustain the pelvic flexion as you arch your upper back. Keep that going. Inhale. And exhale. 2 more of those. Inhale. And exhale. Push yourself back into a wide-legged child's pose, resting the forehead down on the floor, pushing the palms into the floor to deepen you into the stretch. Inhale 1, breathe. Exhale 1. Inhale, pelvis grounds down. Exhale, inner thighs pull back. Inhale, pelvis grounds down. Exhale, inner thighs pull back. And 1 more. Inhale, pelvis grounds down. Exhale, inner thighs pull back. Round yourself up. Take your time coming up to stand. Be mindful that the blood pressure can be affected when you're pregnant. Join me standing. Interlace your hands behind your head. Tuck your chin to your chest, stretching out the back of the neck. Hold it here. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Inhale 4. If the back side of the side of the neck is tight on the right side, look under the left armpit. And vice versa. If the left is tight, look under the right. 3 more breaths here. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale, center the head. Exhale, lower the arms, floating the head back up onto the spine. Roll the shoulders back 1 time. Soft bend in the knees. Relax your jaw. Soften the gaze. Great work. Grab your blue Theraband. We're going to hold on to that blue Theraband, standing in the center of our mat in a wide second position. Hold the Theraband like you would a jump rope, throwing the center of it around your shoulder blades. I'll turn around. I take it under my armpits, but notice where the band is hitting. I want it around your shoulder blades. You can just hold the end of the band. It's not about how you're holding the band. Just make sure you can hold on to it. Elbows are soft. You don't even have to wrap it around your knuckles because sometimes that can be uncomfortable. Flip the palms up. The band is here as a reminder that I want you to puff your shoulder blades into that band to engage your upper back more. We're going to inhale, and on our exhale, we're going to let our inner thighs pull us into a side lunge. Holding it here with our serve the platter arms. Inhale 1, puff the shoulder blades into the band. Exhale 1. Inhale, pelvis grounds down. Exhale, inner thighs pull back as you puff the shoulders into the band. Inhale, and exhale, bring yourself back up to center. Beautiful. So 3 breaths at the bottom, alternating sides. Exhale, sitting back to the other side. Inhale 1, breathe. Exhale 1. Inhale, pelvis grounds down. Exhale, inner thighs pull back as you puff the shoulder blades into the band. Inhale 3. Exhale 3. Inhale back up to your tall spine. Try to not lock the knees at the top. Continuing. Switch sides. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Inhale back to center. Don't lock the knees. Take it to the other side. Puff the shoulder blades into the band. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Inhale, bring it back to center. Exhale, inner thighs pull you back. Inhale 1. Puffing the shoulder blades into the band. Exhale 1. Plug the shoulders down. Inhale 2. Pull the inner thighs back. Exhale 2. Inhale 3. Exhale 3. Inhale back to center. Final set. Exhale, inner thighs pull you back. Inhale, pelvis grounds down. Exhale, puff the shoulder blades into that band. Inhale, pelvis pulls down towards the floor. Inner thighs pull back. Exhale, 1 more breath. Inhale. And exhale. Inhale back up to center. Set that blue Theraband to the side. Coming over to your wall for our wall pendulum to release our upper back after all that hard work. Bring your spine against the wall, tailbone connected, walk your feet forward a foot, heels together, toes fist distance apart. Lift the belly in towards the baby, lift up on the muscles that stop your stream of pee, hanging over. Inhale, prepare, exhale, arms pendulum away from each other, 2, 3, 4. Inhale, pause the arms, exhale, the arms circle, 2, 3, 4. Inhale, pause, and exhale, they circle, 2, 3, 4. Good. Inhale, pause. Exhale, they circle. Keep pulling the belly in towards the baby and lifting up on the muscles that stop your stream of pee. Round yourself up on a slow 5 count. 5, 4, 3, 2, 1. Inhale. Make sure your tailbone's connected. Pull the belly in towards the baby. Lift up on the muscles that stop your stream of pee, folding forward. Upper body relaxing down, arms relaxed, shoulders, forehead, facial muscles, jaw. Inhale, prepare, belly into the baby. Exhale, lift up way below the belly button of the muscles that stop your stream of pee. Arms pendulum out, external rotation. Inhale, pause. 2, 3, 4. Exhale, they circle. 2, 3, 4. Inhale, pause. 2, 3, 4. Exhale, they circle. 2, 3, 4. One more. Inhale, 2, 3, 4, and exhale, 2, 3, 4. 5 counts to round up for 5, 4, 3, 2, 1. Grab your blue Theraband. You're going to tie a knot at the end so that you can bring one of your feet through that band. We're going to be doing shoulder flexion with tree pose. Standing on that band, it's a little easier to maneuver when it's around the arch of the foot, like so. And I'm going to do this traveling towards you. If you're concerned about your balance, feel free to do this by a wall, bar, or counter. I'll start with it on my right foot, wrapping the end of that band around the knuckles of my right hand. I'll step forward, bringing the arm into shoulder flexion and the other leg into a low tree pose, bringing the foot to the calf. If you can do the advanced tree pose, great, but please stick with this beginner version so that we can work on some other things. Keep your pelvis square to me. Take the free hand and massage from the top of the hip down the thigh, reminding yourself that the hip flexors can let go and you can pull the belly in towards the baby and lift up way below on those lower pelvic floor muscles to keep you upright. Shoulders plugged down, no forward lean. Put your backpack of cement on. Beautiful. Now that same leg we just stepped forward on, I want you to step backwards through space, finding tree pose. Find the balance. Once you have that and shoulder flexion, shoulders plugged down, backpack of cement on, inhale. Exhale, massage the thigh down. Inhale, grounding. Exhale, massage the thigh. Again, inhale. And exhale, massage. Go ahead and switch sides. Set up, putting that loop around the arch of the foot. We'll start by stepping forward through space, finding the balance, shoulder flexion, inhale. Exhale, pull it, pushing down on the fascia of the thigh. Inhale, grounding the pelvis. Exhale, pushing down on the fascia of the thigh. One more, inhale. And exhale, gliding the hand down, massaging that fascia. Release the leg that's in tree pose, stepping the leg that's on the band backwards through space, finding tree pose, stepping back to balance, shoulder flexion, chin up, gaze higher than eye level, belly in towards the baby, lift up on the muscles that stop your stream of pee. Inhale and exhale, pressing down the thigh. Inhale, square your pelvis to me, and exhale, massage down the thigh. One more time, fight for that balance. Inhale, and try to not lock out the elbow of the extended arm, keeping the wrist flat. Let's set that blue Theraband to the side. We're going to move into pigeon pose. If you know that your hips are pretty tight, feel free to grab a pillow of some sort from your home, a bolster pillow, to put under the hip. But you can do this without a pillow or bolster if you have nothing, by keeping the hands active and using a little bit more of the back and the abs to keep you in the posture. You'll start in a kneeling position, bringing the right foot towards the groin, towards the baby, and you can extend the shin a little closer, a little farther away from the body to create space when you fold forward. So you don't have to have the foot in towards the groin completely, because that may not be comfortable and it may not allow for that baby to rest down on the floor comfortably. So once we're upright in our pigeon pose, I want you to slide that shin forward, keeping the toes pointed. Notice my back leg, shin, and toes are down. I'm going to walk forward into the posture and hold it here. Inhale one, breathe. Exhale one, pelvis is squared to the front of the mat. Inhale, pelvis grounds down. Exhale, inner thighs pull back. Inhale, pelvis grounds down. Exhale, inner thighs pull back. Inhale, belly button is in towards the spine. Exhale, muscles way below the belly button lift in and up. Inhale, 3. Exhale, 3. Inhale, 4. Exhale, 4. Inhale, 5. Exhale, 5. Going to 6. Inhale, 6. Brace the abs, walking the hands back to the hips, back by the hips on the floor. Rise up onto those knees. Switch your pillow or bolster if you needed one to the other butt cheek, bringing the left foot in closer to the groin. You can actually bring the foot close to the opposite hand to create more space for the baby. Pointed toes, square the pelvis to the front of the mat, deep lift of the core and low abs, walking the hands forward, surrendering into your posture, opening up the outer hip as well as the posturally tight hip flexors. Breathe with me here. Inhale 1. Exhale 1. Inhale, pelvis grounds down. Exhale, inner thighs pull back. Inhale, pelvis grounds down. Exhale, inner thighs pull back. Beautiful. One more. Inhale, pelvis grounds down. Exhale, inner thighs pull back. Inhale, slowly walking up, making your way into a comfortable seated position. We'll end with eyes closed, hands on our belly, 3 TVA breaths together. Inhale, laterally into your side body. Pull the belly in towards the baby. Lift up on the muscles that stop your stream of pee. Sustain that lift. Fog a mirror with your exhale. 2 more. Inhale, 2, 3, 4. Belly to spine. Way below the belly button. Lift up. Hold that lift. Exhale. And 1 more. Inhale laterally. Belly in towards the baby. Tug in and up on the muscles that stop your stream of pee. Fog a mirror with that exhale. Great job.